Autism. If a child can't learn the way we teach, maybe we should teach the way they learn. Ignacio Estrada. According to the CDC, autism spectrum disorder, also known as ASD, is defined as a developmental disability that can cause social, communication, and behavioral challenges. Autism spectrum disorder can begin during early childhood and can continue throughout a person's life. The symptoms, the diagnosis, and the treatments are the focus points when learning and dealing with autism. First, we will discuss the symptoms of autism spectrum disorder. The symptoms may include preferred routines, such as having trouble with adapting to when something changes. Echolalia, which means repeating or echoing words or phrases said to them in place of normal languages. Avoiding social contact, such as preferring not to be held or cuddled, but only when they want to. Now that we have discussed the symptoms of autism spectrum disorder, now let's look at the possible ways to diagnose autism spectrum disorder. The University of Michigan Autism and Communication Disorders Centers states there are 2 steps in the diagnosing process of autism spectrum disorder. The first development, which is developmental screening, which is a short test to see if children have met developmental milestones accordingly. The second step is comprehensive diagnostic evaluation, which includes looking at the child's behavior, hearing and vision screenings, genetic and other medical testings. These evaluations can be performed by licensed professionals such as developmental pediatricians, child neurologists, and child psychologists. So now that we have identified the symptoms and the ways to diagnose autism spectrum disorder, the final focus point is the varieties of treatments for autism spectrum disorder. According to the National Research Council, there is no set cure for autism spectrum disorder. However, there are many different types of treatments available today. The different types of treatments are broken down into behavioral and communication approaches, such as speech therapy, dietary approaches, such as changing the child's diet, and some even choose medication, such as complementary medicines and even alternative medicines. So the question is, who can be diagnosed with autism? Everyday people, athletes, and even celebrities can be diagnosed with autism. Here's a small sample of the celebrities that have been diagnosed or are living with autism today. This includes Susan Boyle, a British singer, Daryl Hannah, a famous actress, Mozart, as we know, the famous composer, Andy Warhol, a famous pop artist, Courtney Love, a musician, and Ghostbusters' Dan Aykroyd, another famous actor. So it's safe to say, autism doesn't discriminate. Dealing with autism spectrum disorder can be challenging. However, if we learn the symptoms, the diagnosis, and the treatments of autism spectrum disorder, the struggle of living with autism can become easier to understand and to cope with, not only for the people who have been diagnosed with autism, but the ones that live amongst them and love them as well. Is there any questions?
How common is autism?
The CDC statistics identify around 1 in 68 American children as on the autism spectrum. Studies also show that autism is 4 to 5 times more common among boys than girls. Any other questions? Yes.
At what age is autism diagnosed?
Though autism cannot be definitively diagnosed until around 18 to 24 months, research shows that children as early as 8 to 12 months may show early signs of autism. Okay, one more question.
Do you think vaccines are to blame?
Over the last 2 decades, research has asked the link between vaccinations and autism. The results of this research are very, very clear. Vaccines do not cause autism.